Good evening. Thank you for joining us tonight, for joining Sharsheret tonight for the latest cancer and COVID-19 medical update. I'm Brianna Schwartz, Sharsheret's Florida Regional Director, and tonight we will be learning from Dr. Starr Mautner about cancer and COVID-19. Dr. Mautner will share the latest information and updates on what we now know about COVID-19 and the current vaccines available. We are grateful to tonight's webinar sponsors, Miami Cancer Institute and Exact Sciences. It's thanks to their support that we are able to continue to provide our series of webinars throughout the pandemic. Before we begin, a few housekeeping items. Today's webinar is being recorded and will be posted on Sharsheret's website along with a transcript. Participants' faces and names will not be in the recording. If you would like to remain private, you can turn off your video and rename yourself, or you can call into the webinar. Instructions are in the chat box now for both options. You may have noticed all participants were muted upon entry. Please keep yourself on mute throughout the call. If you have questions, put them in the chat box either publicly or click Sharsheret on the chat box to submit a private question. We received many questions in advance of the webinar and anticipate many questions in the chat box. We will do our very best to answer all questions, and any questions not answered tonight will be addressed by email during the coming week. We recommend you keep your screen on speaker view. This will enable you to see Dr. Mautner and her presentation while she is speaking. You can find this option in the upper right-hand corner of your screen. As a reminder, Sharsheret has been providing telehealth services to the breast and ovarian cancer communities for almost 20 years, and the pandemic has not changed that. We continue to be there for each and every one of you. As we move into the webinar itself, I'd like to remind you that Sharsheret is a national, not-for-profit cancer support and education organization and does not provide any medical advice or perform any medical procedures. The information provided by Sharsheret is not a substitute for medical advice or treatment for specific medical conditions. You should not use this information to diagnose or treat a health problem. If you have any questions that are specific to your medical care, Dr. Mautner may not be able to advise regarding specifics, and we recommend that you speak directly with your own medical provider. Always seek the advice of your physician or qualified health provider with any questions you may have regarding a medical condition. Before we get started with Dr. Mautner, I'd like to introduce one of our Team Sharsheret members, Tracy Hecht, to briefly share her personal cancer experience with us. Tracy?
Hey guys, thanks for having me. So just a quick story of what I went through. So as we know, the lockdown started last March, and in May of 2020, I found a lump in my breast as well as in my breast milk as I was breastfeeding a newborn. I didn't want to go to the doctor because of the pandemic, didn't want to be exposed, but the stars aligned and I was urged to go, and one thing led to another. I was diagnosed with stage 3 triple negative breast cancer at the age of 36. I went to chemo for 5 months and then had a bilateral mastectomy.
Tracy?
Dr. Mautner.
Tracy?
And an awesome plastic surgeon. I had that done in November. I have 3 more radiation treatments, which I should finish this week. Just started oral chemo for 6 months just to clean up anything that might be floating around my body. And then hoping to get back to normal life, just like everybody else. I got my vaccine. I got both vaccines. My second dose was 2 weeks ago.
So I'm sorry, I muted Tracy. There was something wrong with her audio.
Can you hear me?
We're having trouble hearing you. So what we're going to do is we're going to hear Dr. Mautner's presentation, and then we'll come back to Tracy at the end, and hopefully the audio will have worked itself out.
Are you able to hear me?
I apologize, Tracy. Okay, so we're really honored this evening to be joined by Dr. Starr Mautner. Dr. Mautner is a board certified and fellowship trained breast surgical oncologist at the Miami Cancer Institute, where she treats patients with benign and malignant breast disease and is the lead physician for breast surgery clinical trials. She earned her medical degree from the University of Miami Miller School of Medicine and completed a general surgery residency at the New York Presbyterian Hospital Weill Cornell Medical College. She completed a research and clinical fellowship in breast surgical oncology at Memorial Sloan Kettering Cancer Center in New York and is an active member of the American College of Surgeons, Society of Surgical Oncology, and American Society of Breast Surgeons. She is the co-chair of our Memorial Sloan Kettering Cancer Center Alliance Education Committee and is very active in her community outreach and educational programs. Dr. Mautner has authored research articles on topics including LCIS and patient satisfaction after mastectomy, and has a special interest in breast surgical oncology clinical research. Dr. Mautner, thank you so much for joining us this evening, and the floor is yours.
Thank you for inviting me to speak. It's an honor. I believe several months ago, I spoke on the topic of metastatic breast cancer and COVID, and I never thought I would actually be speaking about the vaccine just a few months later. And so this is really exciting. I am very pro-COVID vaccine, and so I'm going to be giving my thoughts from my perspective as a breast surgical oncologist. I work at the Miami Cancer Institute. I treat many patients with breast cancer, and I've seen the direct impact of COVID on our patient population. And while we couldn't hear all of Tracy's story, she is a patient of mine and was hesitant to go to her physician when she first felt a breast lump due to the COVID-19 pandemic. And we're really starting to see the effects of that in patients that are presenting with later stage disease and delays in diagnosis due to COVID. I created a very short PowerPoint to kind of organize my thoughts on the subject, and then we're going to leave a lot of time available for people to be able to ask questions. So I'm going to share my screen, and hopefully you guys will be able to see me and hear me and see the PowerPoint simultaneously. Okay. So this is just a summary of where we are today in terms of the numbers of cases in the United States. There are currently approximately 331 million people living in the United States, and 28 million people have contracted COVID in the United States. Almost 500,000 have died of COVID over the past year. Last month, COVID was the leading cause of death in the United States. So let that sink in. That's more deaths due to COVID than heart disease and cancer. And that is a scary statistic right there. January 2021 was the deadliest month from COVID. 37 million Americans have now received at least their first dose of the vaccine, and 13 million are fully vaccinated with both doses of the vaccine. And the projections are that 145 million adults in the United States should be vaccinated by June 1st, and this would prevent 114,000 deaths. Specifically when it comes to the vaccine and cancer treatment, this is a very unique population of patients because many patients that are undergoing treatment for their cancer are considered immunocompromised. And due to this, at least at the Miami Cancer Institute, we have been prioritizing these patients. So anyone that is having surgery for a diagnosis of cancer within a 3-month time period, or is receiving chemotherapy or radiation therapy for the treatment of their cancer have now taken priority to receive the vaccine, along with those that are 65 and older. We receive a lot of questions about whether or not it's safe to receive the vaccine for cancer patients. The vaccine is not a live virus. It is very safe to give to immunocompromised patients. And so almost all of our cancer patients are actually candidates to receive the vaccine if they would like it. Cancer survivors are another special and unique portion of the population. So even patients that are not currently undergoing active treatment but have survived a cancer diagnosis, many of those patients have other significant comorbidities. Cancer is usually a disease of aging. And so many of these patients also have heart disease or kidney problems or lung dysfunction. And so patients who have had diagnoses and have been treated for cancer may have other reasons that can put them at risk for severe COVID, even if they are not undergoing active treatment. And so they should be given priority as well for receiving the vaccine. There are only a few types of cancer patients that should not receive the vaccine. And one example of that are those patients that are undergoing a bone marrow transplant. And that makes up a very small proportion of cancer patient populations. But in general, let's say breast cancer patients, which is my practice, I would advise that basically all patients that are interested in receiving the vaccine do receive it. Another factor in considering the impact of COVID and cancer, as we already mentioned, is the decline in patients going for their screening mammograms or going for additional workup when they feel a mass. There's been over a 50% decrease in breast cancer diagnoses when we look back between March and April of 2020. And that was not because there is less cancer out there. It's because women were not going to get their screening mammograms during that period of time. The NCI projected that this would lead to more cancer death, and specifically an extra 10,000 cancer deaths in the next 10 years. And these are all preventable deaths. I'm definitely seeing the impact of that in my own practice. Many of the patients that I have seen recently are being diagnosed with more advanced disease, more lymph node involvement. The cases are just more complicated because there's been delays in diagnosis. And I personally think that the number will be even higher than 10,000 over the next 10 years. When we look at all cancers, there's been a decline in colon cancer screening as well with colonoscopy. I also receive a lot of questions about timing the vaccine, like when is the ideal time to receive the vaccine if you're about to undergo surgery or if you're about to have breast imaging. So in general, it would be safe to receive the vaccine before or after surgery, and we don't necessarily have to time it specifically to a certain day. However, the only advice that I would give patients is I probably wouldn't take the vaccine the day before undergoing a major procedure, because you can have some side effects. Most of those side effects are very short-lived. They last about 24 hours, but some of those side effects include a fever. And if you were to spike a fever 24 hours before a major surgery, most likely that surgery would get canceled. And in the same way, I probably wouldn't schedule my vaccine for the day or 2 days after undergoing a major surgery, because some of those side effects can mimic complications from a surgery. So if you were to have, let's say, a mastectomy and then 2 days later receive your second dose of the COVID vaccine and spike a fever, there may be some confusion whether that fever is due to the vaccine itself or to an infection that is brewing from surgery. So that being said, we're trying to time the vaccines about a week prior or a week after a procedure, and not just within the first couple of days before or after. Most recently, a hot topic has been breast imaging, because it's been noted from the vaccine trials that there is a side effect of the vaccine called axillary lymphadenopathy, meaning enlargement of the lymph nodes under the armpit, that's seen in 11% of patients undergoing their first dose of the vaccine and 16% of patients undergoing their second dose of the vaccine. Lymphadenopathy, or an enlarged lymph node, is actually a normal side effect of receiving a vaccine. It means your immune system is working. And you can also have the side effect if you were to have an infection as well. The reason why it becomes an issue, especially when dealing with patients who are being screened for breast cancer or who have a history of breast cancer, is if we see enlarged lymph nodes on imaging, it may mean that there is concern that the lymph nodes could potentially contain cancer. And so what we are doing in patients that have enlarged lymph nodes seen on their imaging, if they recently received their COVID vaccine, we're telling them to come back for imaging 4 weeks later with a repeat ultrasound of the axilla. And that at that point in time, we would expect to see those lymph nodes have resolved. If they have not resolved, then a further workup would be taking place. And so there's a question as to, should I delay my mammogram, my screening mammogram, because I just had my COVID vaccine? I mean, I think you can consider delaying it, but I honestly would tell patients, if they're scheduled to get their screening mammogram, just get it. The axillary lymphadenopathy doesn't happen in all patients that receive their vaccine. And if it shows that you do have enlarged lymph nodes on that side, all you have to do is repeat the ultrasound 4 weeks later and tell the radiologist that you recently had your COVID vaccine. For patients who have had a history of breast cancer, I would use the arm that is not associated with the side of the cancer. So for a patient, let's say that had a right-sided breast cancer, I would tell them to use their left arm for a couple reasons. One, if they're at risk for lymphedema, you never want to use an injection in that arm because it could put you at risk for infection and lymphedema in that arm. But also if it does increase the lymphadenopathy or increase your size of your lymph nodes on that side, there could be concern that it's recurrent cancer, and confusing that with side effects from the shot. The bottom line of all of this is I would get the vaccine as soon as it's really offered to you, because you may not get another chance for several months. I know people that have delayed getting the vaccine initially because they had some concerns, and then they decided, 2 or 3 weeks later, okay, I'm ready to get the vaccine, and then it wasn't available. And so I would take it as soon as it's offered to you. There's also an app on the smartphone that a lot of people don't know about. When you go and get your vaccine, they offer you several slips of paper that talk about the vaccine. And one of those slips of paper is something called the V-Safe smartphone app, and it tracks your side effects. And so I think that I used that app when I got my vaccine. And it's important because it relays that information for future studies to know what side effects are expected, and they can help give you information if you're having side effects of what to do about those side effects as well. There are a lot of questions that I've received about the COVID vaccine and fertility, and I really am still unsure as to where these questions are coming from, because there's really no evidence that the vaccine affects your ability to conceive or affects pregnancy in any way. I have a feeling there must be some message board on social media that is saying there is some concern or risk factor, but there really is not. In the Pfizer trial, 23 women became pregnant after receiving the vaccine, and so far there have been no adverse reported events in those women. There was one woman who miscarried, but she was not in the group that received the vaccine. She was in the placebo group that did not receive the vaccine. So there's no evidence that it leads to miscarriage as well. There is a new registry study now that's studying the effects of the vaccine in pregnant and lactating women. Pregnant women were not included in the original study. And there is no evidence that the COVID vaccine affects fertility or increases risk of miscarriage, as I said, and there's no reason to delay conception or fertility treatment if you're receiving the COVID vaccine. However, there is significant risk if you contract COVID while you're pregnant. And so that's something to think about. If you're concerned about getting the vaccine, really you should be concerned about getting COVID while pregnant. So if you're pregnant and you get COVID, there is an increased risk of hospitalization. There's an increased risk of complications, including ECMO, and then there's an increased risk of death and miscarriage. And so in women that ask about fertility concerns, I'm really more concerned about them contracting COVID than I am concerned about them receiving the vaccine. I have several friends that have received the vaccine in all trimesters of pregnancy, and they are happy that they did so. And lastly, there's new data that's emerging that the vaccine is safe and effective. So for all of the people that are saying, I need more information, I want to wait until there are more studies, Israel has been very proactive in their approach to vaccinating their population. And on Sunday, they reported that there has been a 94% drop in symptomatic COVID-19 infections among 600,000 people who received both doses of the Pfizer vaccine. And this is the largest study to date coming out of Israel. They have a more homogeneous insurance program so that they're able to easily track people that are receiving the vaccine. Their largest insurance group covers more than half of all Israelis. In that same group, there was 92% less likely to develop severe illness if you did contract the virus. And there was a comparison group of the same size that had the same comorbidities. So this is a really good study that's coming out of Israel, and I already knew that the vaccine was very effective by the evidence that's already out there, but to help convince people who are still unsure, this is very good news that's coming out of Israel. In summary, just say yes to the COVID vaccine. The side effects are minimal. I'll tell you about my experience with receiving the vaccine. I got my first dose in mid-December. I had no side effects really from that dose. I had a little bit of a sore arm, but that was it. My second dose I received in the beginning of January and felt fine. I got it in the late afternoon that day. I was a little tired, went to sleep, and woke up the next morning and felt just a little bit weak and achy. I had some chills. I had no fever. I went to work, kind of worked half a day, and then the rest I did virtually, and was very tired. I went to sleep by 8 p.m. that night. The next morning, I woke up and felt 100% better. And from the stories that I've heard of others that have received their vaccine, anyone that did have side effects were limited to this first 24-hour period. And so I really think that the risks of receiving the vaccine and the side effects associated with the vaccine really pale in comparison to actually contracting COVID. Peak immunity is reached at 2 weeks post the second vaccine. So don't go and get the vaccine after the first dose thinking that you're immune and go out to a bar, because you probably will contract COVID. You're not immune until you get your second vaccine. And usually that immunity doesn't actually take full effect until the second week after receiving that second vaccine. The vaccine works. It is 95% effective. And it's really the best way and the only way that we're going to end this pandemic with the least number of lives lost. The pictures at the bottom kind of just outline my experience over the past year in wearing tons of PPE, shields, masks, operating under these conditions, totally transitioning the way that we treat patients. You know, I never imagined in a million years that we would be doing this over an entire year, but we are. The second picture is me receiving my first dose. The third picture is me receiving my second dose. Then I took an at-home antibody test and saw that I had antibodies 2 weeks later, which I was ecstatic about, because, you know, it just proves that without ever really contracting COVID, I had IgG antibodies and the vaccine works. And then lastly are my two kids, and the reason for everything that I do, and they're adorable in their masks, but they're even cuter without their masks. So I'm looking forward to ending this pandemic, and we really need everyone to pitch in and do their part. Even after getting the vaccine, you still have to wear a mask, you still have to social distance until we can get the majority of the population vaccinated, and then we can really end this. So I appreciate your attention. Thank you for inviting me to speak, and I'm available to answer any questions that everyone has.
Dr. Mautner, thank you so much for that. We've had a ton of questions come in tonight, and I anticipate, I see the chat box is going wild, so thank you. I encourage everyone, if you have questions, to please put them in the chat. Before I start questions though, I think our speaker Tracy has, I'm gonna ask her to share her story, and then we'll get started with the question. So Tracy.
All right, can you guys hear me this time?
Much better.
Okay, I'm sorry about that. So just to quickly start from the beginning, as we know, I was breastfeeding my newborn and felt a lump, thought it was a clog, put it off, had blood in my breast milk, and was urged to go to the doctor. I really didn't want to, because I didn't want to expose myself to COVID, but the stars aligned. I saw the physician. I was diagnosed with stage 3 triple negative breast cancer at the age of 36, and went through 5 months of chemo, had a double mastectomy with Dr. Mautner, and an awesome plastic surgeon that works with her at Baptist MCI. I had that in November, recovering pretty well, and started radiation about 5 weeks ago. I finished on Friday, and I started oral chemo, Xeloda, yesterday to hopefully clean up any other little cells that might be floating around in my body to help prevent recurrence. So I did get both COVID doses, or the vaccine doses. My second one was exactly 2 weeks ago. My experience was pretty similar to Dr. Mautner. The first dose, I felt almost nothing. I barely even had arm pain. And then the second dose, I had it at 8:15 in the morning, felt fine that day. 8:15 the next morning, I got some chills, some achiness. About 10 or 11, I actually developed a fever of 101. It went down a little bit with Tylenol, but throughout the day, I still felt okay, especially compared to chemo. And then went to bed, woke up sweaty, and my fever broke, and I was fine. So my arm actually still didn't hurt for that one. And any side effect I can think of is pretty much better than getting COVID. So, and hopefully putting this thing to an end. So Dr. Mautner's words were perfect. They were amazing. Listen to her because she's really smart, and go get your vaccine, please.
Thank you, Tracy. I'm glad we worked out our internet issues. So thank you for sharing your story tonight. All right, so I want to get to some questions with Dr. Mautner. Firstly, is one of the questions that came in before, and I've seen it in the chat, is the vaccine impacted by chemo or radiation? What would you recommend with timing the vaccine if you're currently undergoing chemotherapy? And does that affect the effectiveness of the vaccine?
So I would first and foremost, if you're getting active treatment with chemotherapy or radiation therapy, speak to your physician and just make sure that they're comfortable with you receiving the vaccine. I will say that I am comfortable with my patients receiving it. In terms of timing the vaccine with chemotherapy or radiation therapy, and will it be as effective? Currently, we don't know. We assume that in some patients that are very immunocompromised, their immune response to the vaccine may not be as strong, but we still think that the vaccine will be effective. And so once again, I would be more concerned with contracting COVID than I would be from getting the vaccine or worrying that it's not going to work as well. So I would recommend still getting it. Now, should you get it on like the day that you're getting your chemotherapy? Probably not. You know your body, you know when you don't feel well and when you do feel well in terms of how many days after chemotherapy you're going to have a bad day. Like I would time it to a day where you are going to feel well, and that any side effects from the vaccine that you might get the next day won't be linked to a side effect from chemotherapy or radiation therapy. But once again, talk to your medical oncologist and radiation oncologist and see what their experience is. As a surgeon, my recommendation to my patients is don't get it like 1 or 2 days before surgery or 1 or 2 days after, and I try to time it about a week before or a week after if possible.
What about those that are at the end of active treatment? So someone who's maybe a few months after treatment, will their response to the vaccine and their effectiveness be different than someone who's in active treatment or someone who is not a breast cancer survivor?
I think it's very variable and it's too early to tell depending on where someone's immune system is at. So normally, let's say if someone's receiving chemotherapy for the treatment of their breast cancer, we wait about a month for their immune system to kind of normalize before operating on them. So it decreases the risk of infection. It probably takes much longer for a month than their immune system to fully recover from chemotherapy. So I would say the longer you wait, great, but at the same time, you're putting yourself at risk for actually contracting COVID during that period of time. And once again, who knows if the vaccine will be available to you if you wait 2 months. So I say get it as soon as it's available and as soon as it's offered to you. We don't know that if we'll need to take a booster, let's say next year, or another vaccine next year, like the flu shot, there'll be more opportunities. You know, if the vaccine is not as effective in someone who's immunocompromised, they may need to get a booster later on. We just don't know yet. I would still get the shot though.
Got it. What about with radiation? For someone who's had radiation, is the vaccine going to be less effective since they've had radiation?
Same kind of thing. I mean, radiation does decrease your immunity and your immune response by a little bit, not as much as chemotherapy usually, but I still get the vaccine. The side effects from the vaccine are so minimal. It is not a dangerous vaccine. It's not a live vaccine. I still recommend, even if you're getting radiation or if you've recently completed radiation, to get the vaccine. You know, if you're weary that you're having an immune response or not, you can try to test with an antibody test. They're commercially available. You can walk into probably MD Now or some of the Quest labs and get it for like $5, even without a prescription. But, you know, everyone that I've seen so far that is tested for antibodies 2 weeks after their second vaccine has tested positive for IgG antibodies. But I would say, even if you don't test positive, it doesn't mean that you haven't had an immune response.
What about is there one, or there are 2 vaccines that are available right now. Is there one over the other that you recommend for those who are in active treatment or in remission?
They're both extremely effective. And you usually don't have a choice in the matter. So when I received my vaccine, I got Pfizer, but it wasn't because I was able to choose. It's just that was what was offered to me. Now MCI is actually switching over to Moderna, probably because they got a shipment of it in. You know, if you actually were able to choose, I like that Pfizer, you only have to wait 3 weeks versus 4 weeks with the Moderna vaccine to get your second shot, but they're both equally effective. And I would take whatever is available to you, whatever's offered to you.
Are there any side effects that are more severe with cancer patients or those who are breast cancer survivors?
I haven't seen that. in any of my patients that have been vaccinated, it's been a similar, some have had no side effects whatsoever, and some have had similar side effects to what I have had. I have not heard of anyone having like prolonged side effects from the shot. Anyone that told me about side effects, it was 24 to 48 hours of side effects that they experienced.
I have a question in the chat box about the Johnson & Johnson vaccine. Do we know anything about it? Can you say anything on it?
Not yet. I don't believe it's commercially available yet. I believe it's a single shot. And once it starts being distributed, I guess it will start to be, it will be offered. I think the more vaccines that are available for everyone to take and the more of the population that we can get vaccinated, the better. So if it becomes available and it's offered to you and you have the ability to take it, take it. These are all mRNA vaccines, which means basically they don't integrate into your DNA in any way. They code for a protein message, basically for your body to produce the spike protein that's seen on the outside of the COVID virus. Once your body produces that spike protein, it should be able to recognize it in the future so that if you're exposed to COVID, it could fight it off. That mRNA is an extremely delicate substance, and that's why it needs to be refrigerated at a certain temperature. It gets degraded rapidly by the body, and so it doesn't like stick around for a very long period of time. It doesn't integrate into your DNA. It doesn't cross the placenta in any way that we know, and so there are all these theories and kind of unfounded concerns out there that people have about this vaccine, but it actually is an extremely safe vaccine.
We have a question in the chat about someone who received a tetanus shot and wants to know if there's any. She had a tetanus shot on Saturday and has an appointment for the COVID vaccine on Thursday, and was wondering if there was a reason to delay or prolong, or if there was any sort of known adverse reaction that may happen.
Not that I know of. The only interaction or concern that I've heard of is in patients that have received the shingles vaccine. They've been advised to wait a certain period of time before receiving the COVID vaccine, but not for a tetanus shot.
What about, lots of questions that are great. Women with metastatic breast cancer. We've had a handful of questions about this. Someone who may be on an oral chemotherapy drug, which obviously makes her very sick. Should someone with metastatic cancer be considering taking a vaccine, or should they be considering taking a vaccine?
Once again, talk to your medical oncologist, but I would say with anyone with metastatic disease, I mean, they have significant risk factors for having complications if they develop COVID, especially let's say you have pulmonary metastatic disease, you already have like lung compromise. I would say absolutely take the vaccine if your medical oncologist is okay with it, because I worry more about the side effects of contracting COVID than I worry about the side effects from the vaccine in someone with metastatic breast cancer. And the other thing we need to think about is a lot of these patients that have advanced metastatic disease, or cancer patients in general that are undergoing surgery, many of them need help. They're not just living alone, they have caretakers. And so because of that, they're forced to have close interaction with people in their house, and they're unfortunately putting themselves at risk. They need the help. And so I would vaccinate so that there's less risk, that you're putting yourself at risk by having people in your house helping you. Some of these patients land in and out of the hospital over and over again due to complications of their cancer treatment, and they're at high risk of getting COVID that way. So I would say absolutely vaccinate.
I'm going back to your last question. You mentioned the shingles vaccine. What was the time period for the delay between vaccinations?
I don't recall offhand. I think you could easily look it up. I don't remember if it's like a 3-week or 30-day or 90-day time period between getting the shingles vaccine and getting the COVID vaccine, but it's pretty well known. It's like one of the only things they ask you before getting the vaccine, like, have you had the shingles vaccine or a live vaccine recently? There's really like no other criteria other than having a recent bone marrow transplant that would preclude you from getting the COVID vaccine. I gave it to my 95-year-old grandmother. Patients that are very well and are very sick are able to still take this vaccine.
Thank you. So I got a lot of questions ahead of time about individual medications. And while we can't go through the entire list of every medication that a breast or ovarian cancer patient could be on, do you hand know of any specific medications that interfere with the vaccine? Are there any also herbal supplements or anything that you think would hinder the effectiveness?
No.
All right.
I'm very pro vaccine.
I see where you're going with this.
I've not said no to any patient that has asked me if they should get the vaccine. Like, everyone should be getting it. Everyone's going to need to get it. We are going to have to vaccinate a majority of the population for this to be over.
I've had this question twice in the chat. I'm going to read it directly. If you've had COVID and work in healthcare, traveling in regions of the country where mask wearing is pitiful, what is your recommendation of getting the vaccine? The CDC guidelines only provide guidelines for if you have had antibody treatment. If you recommend 90 days, then why are doctors performing the antibody test?
Okay, I think there's confusion between a couple of things. So antibody treatment and antibody tests. So there's a treatment that's like an experimental treatment called BAM that's given for patients that have early COVID that have comorbidities or over 65 years old. And after receiving that treatment, you do have to wait 90 days before getting your vaccine. That's different. So someone that has contracted COVID and recovered and never got that antibody treatment, they are also directed to wait a short period of time before receiving their dose of their vaccine. I would still recommend that if it's available and you've already had COVID and recovered, that you still get the vaccine, because we've seen, 90 days out or over 3 months out that someone's immunity can wane, that they no longer have antibodies when they check for it. And so I would say, especially if you're still traveling, people can contract COVID more than once, and there's different strains out there. And now we know that there's these other mutated strains that are coming out. And so I would still worry, even after having COVID and recovering, that you could contract it again. And I would say if they're offering it to you and it's available, get the vaccine still.
Do you recommend having the vaccine administered in your dominant arm or non-dominant arm? And also, we had a question about it. If someone has lymphedema, are they able to receive the vaccine on their bottom, not in their arm?
Okay, so in terms of dominant versus non-dominant, I chose non-dominant. That's where I always get any like the flu shot also, but it doesn't matter. I got it both times on my left arm, but can you do your left and then your right? You can. It doesn't matter, whatever arm you want. Now, if you have lymphedema, I would say do it in the other arm, obviously. And the question was, can you do it in the buttock or somewhere else? I believe the answer is yes. It just is an intramuscular shot. I haven't seen anyone getting it in another area of the body, but I do believe that they can administer it in another area of the body other than the arm.
Thank you. Do you suggest an antibody test after vaccination, especially if you have metastatic breast cancer or are immunocompromised, to ensure that it's working?
So the question is, what are you going to do if it doesn't show, if the antibody test doesn't work? But if you are going to do it and you want the reassurance of doing it, wait 2 weeks after your second shot, because I tested 1 week after my second shot and I did not have antibodies, or at least I wasn't to the level that I was able to see it on the test that I had. So wait a full 2 weeks to make sure that the test is going to be accurate. And you should have IgG immunity. You should see the strip that lights up for IgG and the control strip light up. Make sure that whoever's doing it for you knows what they're doing so that they do the test correctly. But I would say, if it doesn't work, what are you going to do? You're not going to be eligible to go get a third vaccine, so there's nothing to do. You're still going to be careful and wear a mask, and you probably do have immunity even if the antibody test isn't positive. But a lot of people do like doing the antibody test to have some reassurance.
I understand that. We've heard of some cases of anaphylaxis being reported. How accurate is this info, and what do you, someone who may have severe episodes with food or nuts, how would that play into their decision to get the vaccine?
So I think initially they were advising, if you do have severe anaphylactic reactions, to consider holding off on the vaccine for now. I do know of some people that have anaphylactic reactions that still got the vaccine. They likely brought their EpiPen with them just in case, and they were fine with the vaccine. I think it's a personal choice. I would speak to your allergist or your primary doctor. And I mean, I don't have anaphylaxis, so it's a personal thing, but I would be willing to maybe risk it, but I think you have to talk to your primary doctor and see what they advise. I'm sure that there's EpiPens at all the sites that they're giving the vaccines at. They do hold you for at least 15 minutes after getting your vaccine to watch you and monitor you and make sure that you're not having any symptoms. If there's a concern, I would definitely get the shot at a hospital setting, not at like some random CVS or Publix, but get it, at the hospital if it's being offered there. If there's a concern that there could be anaphylactic reactions. If you're asking me, have there been any like deaths associated with the COVID vaccine? I've heard of anecdotally like 1 or 2, literally after millions have been given, and we don't know how many deaths there's been with COVID. And so I don't think that there is evidence that the vaccine is deadly in any way. But yeah, just like any vaccine or shot or medication, there's a very low risk of anaphylactic reaction.
The purposes of qualifying for a COVID vaccine, for vaccination, someone asked if they can claim they have cancer if they are currently taking drugs to prevent a reoccurrence of breast cancer that they've had.
So you're talking most likely, if we're talking about breast cancer, we're talking like endocrine therapy, right?
Okay.
And patients are on 5 to 10 years of endocrine therapy. I think I consider that active treatment. We've been able to vaccinate patients that are on endocrine therapy, but it's going to depend on like where you're getting treated. And it's like very state by state and center by center. At Miami Cancer Institute, we have been able to vaccinate patients like that. But like, let's say you're getting treated at another cancer institute and they don't have it available. And so it depends on where you are. But as I said, I believe, in the future, everyone is going to be eligible or need to get this vaccine. So if you can get it where you're being treated, get it. And yes, I do consider that, active therapy, because if you were to contract COVID, part of that therapy may need to be stopped due to complications of COVID. So we're trying to prevent that. We want you to be able to get treated for your breast cancer, even if it's just maintenance therapy to prevent recurrence in the future. There could be severe complications of COVID having to do with that and having you to stop your medication. So still get the vaccine if you're eligible, even if you're just on endocrine therapy.
Are there risks of getting an autoimmune disease after getting one of the mRNA vaccines? I see you shaking your head.
No.
Okay. We have had a lot of questions about life after a vaccination. So one of the questions that came in, we all know that Passover is coming up, an opportunity for families to convene. The question that was posed was, once my family is all vaccinated, can we get together for an indoor meal?
I mean, good luck having your entire family vaccinated, right? Because I think for most people that's not a realistic thing that's going to happen within the next month, before Passover. But, I would still play it safe, because as I said, I think it's unlikely that your entire family will be vaccinated, fully for an indoor meal. But if they are, I think the risk would be minimal at that point. If you have kids involved at that meal, the kids are not going to be vaccinated. So what I would do to play it safe, especially if you're in Florida, I would plan to do the meal outside. And if you can separate the tables by family, that's the ideal way to do it. And if anyone's going to be hanging out inside, they should be masked. So I don't think that for this Passover, we're quite there yet where you're going to have your entire family vaccinated fully for dinner. But by next Passover, I would hope so, for sure. So I would still play it safe. I mean, I'm fully vaccinated, as are a few of my family members, but my kids are not, and they're not going to be for a very long time, if ever. And so when we do small family gatherings, we still do them outside.
Thank you. I think we have if there are any other questions, I think you really addressed a lot of the general questions that people had. One last one. Does aromatase inhibitor therapy as a cancer survivor qualify you as going through active treatment?
I believe at MCI it does. I can't say that depending on where you're being treated and who your medical oncologist is, and if it's available at the center that you're being treated, if they'll give it to you. But for a period of time when we had, I guess, enough vaccine, like a lot of our cancer patients were being offered the vaccine and they were eligible to get it. And then like they ran out of vaccine and all the patient appointments got canceled. And now I think they got a new shipment in and everyone's getting on the schedule again very quickly. So I would say talk to your medical oncologist and tell them if you're interested in getting the shot and see what they can do to help you get it. Everyone's going to have to get it. So if it's available, try to get it.
thank you for sharing your expertise tonight and for educating us. I think this was very informative, lots of questions answered. If your questions were not answered, we will go through the chat question box and try to answer any other questions via email throughout the week. I want to thank you, Dr. Mautner, for educating us this evening. I know that you answered a lot of questions. I know our participants feel more knowledgeable after hearing your presentation. Please take a moment, everyone who is on the call, to fill out a brief evaluation survey that is going to be linked in the chat box now. Evaluations really do inform future programming, so thank you for participating. We are grateful to you. There's the chat. In the chat is the SurveyMonkey link. I also want to thank today's sponsors for the webinar, Miami Cancer Institute and Exact Sciences. We'd love for you to stay connected with Sharsheret via social media, where we post about events like these, program updates, and fun ways to get involved. Please follow us on Facebook and Instagram, where our handle is @Sharsheret1. Please remember that Sharsheret is here for you and your loved ones during this time. Sharsheret promotes emotional support, mental health counseling, and other programs designed to help navigate you through the cancer experience. All are free, completely private, one-on-one, and our number is 866-474-2774. You can also email us at clinicalstaff@sharsheret.org. That is also in the chat. Our social workers and genetic counselor are available to you, and you are our top priority. So please never hesitate to reach out. We are all going to get through this together. Finally, I want to let you know that we have several exciting webinars on a wide range of topics planned over the next few months. Too, I want to specifically point out our peer support training webinar is coming up on Tuesday, February 23rd at 8 p.m. Eastern and 5 p.m. Pacific time. Whether you've already enjoyed the rewarding experience of serving as a peer supporter, or are waiting for your first Sharsheret match, or considering being a peer supporter, please join us for that webinar. Also on March 17th at 2 p.m. Eastern and 11 a.m. Pacific time, we are hosting recipes and tips for a healthier Passover with Ilana Molstein, creator of 2B Mindset. This program is part of the Sharsheret in the Kitchen series, which brings nutritious kosher meal options to our holidays and help empower all of us at risk for breast and ovarian cancer to make healthier diet choices. Please check our website regularly to see what topics are coming up. The link for our website is in the chat, and you can also access all of our recordings and transcripts of past webinars at that link. So thank you so much for joining us. Thank you, Dr. Mautner. Thank you, Tracy, for sharing your personal experience. And thank you to everyone on the our Sharsheret call tonight for joining us. Thank you so much.
Fast on mute to say thank you, everybody.
Thank you.
Thank you.
This was
Very
awesome.
good.
Thanks.
Thanks, Starr. Thanks, everybody.
Thank you so much. Bye-bye.
Thank you very much for that answer about the COVID. That made me feel better.
Thank you, everyone. Have a wonderful evening.